Hi, so a 25-year-old woman from Bangalore has been experiencing gradual weight loss, frequent vomiting, and irregular periods over the past 2 years. Now, she hasn't had a period for 6 months. The underlying cause? Atypical anorexia nervosa, a condition triggered by external pressures about body weight. And she's not alone. Around 17.8 million women worldwide face this issue. This condition is called amenorrhea, the absence of menstruation for 3 months or more. Hi, I'm Dr. Rashmi Niphadkar, and in today's video, we are breaking down what is secondary amenorrhea, why it happens, and what can you do to get your period back. So what is secondary amenorrhea? Now, this term refers to the absence of periods for 3 months or more in someone who has previously had regular cycles. Unlike primary amenorrhea, when periods never start during puberty, secondary amenorrhea happens after your menstrual cycle has already been established. In a normal cycle, hormones like estrogen and progesterone rise and fall, triggering ovulation and menstruation. Secondary amenorrhea happens when something disrupts this balance, stopping your cycle altogether. So why does this happen? Every hormone in your body plays a part in maintaining your menstrual cycle. If one goes out of sync, the entire system can be affected. Now, here are some common causes of secondary amenorrhea. So the number one cause is extreme dieting and overexercise. Many athletes, dancers, and fitness enthusiasts experience amenorrhea because their bodies lack the necessary fat in order to maintain the hormone production. Dropping below 22% of body fat can shut down menstruation. Take for example Bridget Malcolm, a Victoria's Secret model who lost her period for 9 years due to excessive dieting and exercise. She consumed only 800 calories a day, surviving on shakes and steamed vegetables to maintain a very low body fat percentage. So what do you need to do? Eat a balanced diet with healthy fats, proteins, and carbs, and 2. Reduce excessive cardio and focus on strength training and gentle movements. Number 2. Stress and mental health. Chronic stress increases cortisol, a hormone that can suppress your reproductive hormones, leading to either irregular or missing periods. So what do you need to do? Prioritize sleep, relaxation, and try yoga, meditation, or journaling to manage your stress. And on number 3 is PCOS, or we all know polycystic ovarian syndrome. Now, this hormonal condition affects 1 in 10 women and is the leading cause of either irregular or missing period. In PCOD, your body produces higher levels of androgen, which is the male hormone, which can disrupt ovulation. And what do you need to do? First, work with a doctor to check your PCOS through ultrasounds and a hormonal panel test. And 2, manage your symptoms with balanced nutrition, exercise, and possibly medications if needed. On number 4 is your thyroid disorders. Now, your thyroid gland controls your metabolism, and any imbalance, whether an underactive thyroid, that is hypothyroidism, or an overactive thyroid, that is hyperthyroidism, can throw off your menstrual cycle. So what do you need to do here? Get a thyroid function test if you experience any period changes, fatigue, weight fluctuations, or hair loss. And on number 5 is a point which people easily miss, that is birth control medication. Now, certain birth control methods, like for example Depo-Provera shot or hormonal IUDs, can cause your periods to disappear temporarily. Certain medications for depression, blood pressure, or cancer treatment may also affect your cycle. In this case, what you need to do, if you recently stopped birth control and your period hasn't returned in about 3 to 6 months, check in with your OBGYN. So how to get your period back? Now that we know the causes, let's talk about solutions. Nourish your body. Your hormones need fuel. Focus on nutrient-dense foods, healthy fats like avocados, nuts, and olive oil, and avoid excessive calorie restrictions. Next is reducing your stress. Your mental health affects your menstrual cycle. Practice stress management techniques. Prioritize quality sleep and set boundaries with your work and relationships. Next is moving mindfully. If you're over-exercising, swap out high-intensity workouts for low-impact movement, for example Pilates, walking, or strength training. The next tip is tracking your cycle. Use a period tracker app to monitor changes. If your period hasn't returned in about 3 to 6 months, consult your doctor for further tests. and also get a medical checkup. If lifestyle changes aren't bringing up your cycle back, it's time to check in with a gynecologist or an endocrinologist to rule out any underlying condition or causes, for example PCOD, thyroid disorders, or hormonal imbalances. So while a healthy diet and exercise are important, everything must be done in moderation. Your body needs essential nutrients to function properly. Your period isn't just about your fertility. It's a vital sign of your overall health. If it's missing, your body is telling you something. So listen to it, nourish it, and don't hesitate to seek medical advice if needed. If this video helped you, please like, comment, and subscribe for more expert health tips. And if you still have questions, feel free to drop them in the comments below.